Your blood sugar can be completely normal, yet your body may already be struggling to burn fat. This is why some people try low-carb diets, keto, or biohacking strategies for weight loss, but still feel tired, inflamed, or stuck. Why does this happen, you may ask? Well, it may be due to insulin resistance. Insulin resistance can exist long before type 2 diabetes is ever diagnosed, and routine glucose tests often miss it. In this video, I will explain the difference between glucose and insulin, how fat loss and ketosis are affected by insulin resistance, and why early action matters. Hi, I am Dr. E.I. Williams. As a practicing physician, I want to help you understand what's happening before diabetes develops. To do that, we need to look beyond blood sugar and into insulin itself. From here, we begin.
Glucose is the sugar measured on routine blood tests. Insulin, on the other hand, is the hormone that tells cells what to do with that glucose. When insulin works well, glucose enters cells and is used for energy. When insulin resistance develops, cells stop responding properly. To keep blood sugar normal, the pancreas compensates by releasing more insulin, often quietly and for years. But when insulin stays high like this, even with normal glucose, something important begins to change. Let's talk about what that means next. As the insulin levels remain high, the body receives a clear message. Store energy. Do not release fat. High insulin keeps fat locked inside fat cells, making fat burning metabolically impossible. So even if calories are reduced, even if carbohydrates are low, and even if someone is trying keto or intermittent fasting, as long as insulin remains elevated, the body is metabolically locked in storage mode. This is why many people struggle with fat loss, even while dieting. In simple terms, fat burning requires low insulin. High insulin tells the body it's unsafe to burn fat, even when plenty of fat is stored. In fact, even low-carb or keto diets may fail if insulin resistance is severe. The body simply cannot access stored fat efficiently, and that leads directly into another important process we need to talk about, ketosis, and how the liver forms ketones. Normally, ketosis occurs when insulin levels drop enough for the liver to produce ketones from fat. This often happens during fasting or carbohydrate restriction, when blood glucose becomes limited and insulin levels fall. In response, fat cells release fatty acids, which the liver converts into ketones, an efficient alternative fuel used by the brain and muscles. Here is the thing, ketones are not harmful by default. In fact, they can support stable energy, reduce hunger, and lower the body's reliance on insulin. However, ketosis depends on appropriately low insulin. Now, when insulin resistance is present, insulin may stay elevated, making it harder to enter or sustain ketosis, even when carbohydrate intake is low. This is why some people feel discouraged after trying keto or low-carb approaches for weight loss. Before we continue, it's important to distinguish nutritional ketosis from ketoacidosis, a rare but dangerous condition seen in uncontrolled diabetes or severe insulin deficiency.
Alright, this is where I want to be very clear. Insulin resistance is reversible, especially early on. From a medical standpoint, this isn't about extreme dieting. It's about reducing insulin demand by choosing nutrition that causes smaller glucose spikes, building muscle through resistance training so more glucose is absorbed without excess insulin, protecting sleep to prevent stress-related insulin surges, and spacing meals to give insulin levels time to fall. Together, these habits help the body respond to insulin more efficiently rather than forcing it to produce more. Be aware that controlling insulin resistance is also how we reduce the risk of type 2 diabetes, not diabetes insipidus, which is a different hormonal condition, but diabetes mellitus, which is insulin-driven.
Okay, what most people don't realize is this. Normal blood sugar does not guarantee metabolic health. Insulin resistance affects fat burning, energy, and long-term disease risk, long before diabetes appears.
If this helped explain why weight loss or even keto diet hasn't worked the way you expected, I invite you to subscribe, because in the next video, I will walk you through how insulin resistance is actually detected beyond routine blood sugar tests. And if you have been told your labs are normal, but you are still feeling tired, gaining weight, or struggling with energy, don't ignore those signals. That's the moment to speak with your healthcare professional, because personalized care starts with looking deeper, not just at glucose numbers. Until next time, take care of your health early and intentionally.